I'm Dr. Chen. I'm an optometrist here at Union Square Eye Care in New York City. So the importance of a comprehensive eye exam. So the way I like to explain to my patients and friends and family about the importance of an eye exam is that there's really two components to an eye exam. The first is to promote clear vision. During this part of the exam, we generally update any eyeglass prescriptions. We can fit patients in contact lenses to correct your vision. And the second component is to check ocular health. Basically, for ocular health, there's a lot of different types of ocular diseases that may cause blindness. So early detection of those types of ocular conditions is key. The back of the eye is the only place in the body where you can see blood vessels without cutting into tissue. So when you come in for an eye exam and we put the dilating drops in, it allows us to monitor the health of those little blood vessels at the back of the eye, which gives us a lot of insight into your systemic health. Whatever is going on in the back of the eye is like a little picture of what's going on all over the body. And lastly, it's to monitor and treat ocular diseases. So during an eye exam, patients also come in to keep their follow-up care for any eye conditions that they have, as well as treat their eye diseases, whether it's through the use of eye drops or different types of procedures. So the first question is, how do we achieve clear, comfortable vision? In terms of achieving clear, comfortable vision, on the right, you definitely see eyeglasses, like correcting your vision prescription, definitely sharpens things up. The way people's vision prescriptions work is it's not necessarily related to the health of your eye. Like just because you wear glasses doesn't mean that your eyes are unhealthy or anything. Your glasses prescription or contacts prescription is related more to the shape of your eye. So depending on how your eye is shaped, it kind of determines how what your glasses prescription will be. For example, like the way the front of the eye is shaped, in addition to the length of the eye, kind of determines that prescription. So your glasses prescription is just inherent to the shape of your eye or the length of your eye, and it doesn't really have to do anything with the health of your eye. On the left-hand side, we see that another important component of clear, comfortable vision is that our eyes are working together as a team. So you have two eyes, and in this top photo, we see that the eyes are pointed straight. They have good ocular alignment. Some people, like from a very young age, they're born or they develop an eye turn. So I'm sure you guys have seen different celebrities or friends or acquaintances that just have an eye turn. Their eye just turns in or their eye turns out. So people with eye turns, they generally have it all their lives. However, over time, some people might feel like their eyes aren't working together as a team as well. So when you look in the distance, your eyes are pointed straight ahead, but when you look up close, your eyes turn inwards a little bit. Some people find that over time, it becomes harder and harder for them to keep their eyes pointed inwards towards each other, and their eyes might start drifting out little by little. In terms of clear, comfortable vision, you definitely need a glasses prescription so that each eye is corrected for clear vision. And then we need to make sure that your eyes are working together properly as a team, that your eyes are pointing at the same place, whether far away or up close when reading. But vision changes over your lifetime. So how many of you have started noticing that, with a lot of time on the computer, your eyes just tend to feel a little bit more tired or heavy or sore? Or how many of you guys have started noticing that, some of the smaller print is just becoming more difficult to read? Like you need to hold things a little bit further and further away. That's very common. After a certain point in life, everybody is going to start needing a little bit of a reading prescription. Welcome to Presbyopia. Basically, Presbyopia it usually affects patients in their ages like 40 to 65. It's it's due to changes inside of the eye. So on this left-hand diagram, here's a schematic of an eye. You have light that enters the eye and it's focused at one point at the back of the eye, right at the, like perfectly at the back of the eye. However, over time, due to changes inside of the lens, inside of the eye, that light is no longer focused at the back of the eye. It's focused behind the eye. And that's responsible for the blurry vision. This is due to the lens and the muscle around the lens inside the eye changing over time. Some symptoms. So this is going to affect everybody in their life. So if you're experiencing any of these symptoms, I would definitely recommend coming in to see an eye doctor. Some of the symptoms are blurry vision up close. The words, especially when reading, it might go in and out of focus. Like at the start of the day, if you're not that tired, reading, everything is very clear, very comfortable. However, towards the end of the day or after a prolonged period of near work, you might feel like your vision and the words on the page are kind of coming in and out of focus or blurring on the page. Some people also might feel some eye strain, especially around like the eyebrow or below around the eye. That's because that focusing muscle that I was talking about is around the eye. This focusing muscle is responsible. It's like a camera focus. It's responsible for focusing things for far away and then for focusing things up close. And over time, that muscle it gets a little weaker over time, and it's just not able to sustain as much near work and reading as you were once able to. If you're experiencing any of these symptoms, don't worry. There's hope. You have options. So in terms of presbyopia, there's definitely options. Unfortunately, there's no like surgeries, or there's no like muscle exercises that you can do to strengthen that muscle. The lens and the muscle just changes over time, and gradually, especially from around like age 40 to 65, every few years, it's going to be more and more difficult to read that smaller print. The way that we correct that or treat that is either with glasses or contact lenses. So there's two types of correction methods for the glasses. One is called a bifocal on the left-hand side. That's where the top of the lens is for distance and the bottom of the lens is for reading. And that lens has a line on it. So I'm sure you guys have seen like friends or family that have like glasses that have a line. The top is for the distance, like looking far away, and the bottom is for up close. There's newer type lenses or models called progressives. These are very popular, especially for people who are on the computer a lot, because it's a gradual transition from distance to up close. So the top of the lens will be for distance, so that when you're walking around like outside, looking at things far away, you can see clearly. The middle of the lens, there's a small area that's for intermediate. That's generally about like a little bit past arm's distance away. So it's like perfect for people on the computer. And then the bottom of the lens is for reading up close. Some people who don't have any prescription in the distance, like let's say like they've never really worn glasses, they also might find that just simple over-the-counter reading glasses does the trick. But you can discuss with your eye care provider like what prescription you should purchase. For those of us who don't like glasses or have just worn contact lenses all our lives, there's newer type contact lens designs called multifocal contact lenses. So that's this diagram here on the right. The way multifocal contact lenses work, it's pretty cool. It's one lens, and in this one contact lens, it's also kind of like a progressive where they have some areas that are corrected for distance, some areas that are corrected for intermediate or computer, and some areas that are corrected for near or reading. And generally, multifocal contact lenses require a little bit of an adaptation period because it's like your brain is seeing multiple images, and your brain, like after you adapt to it, learns how to, when it's looking at the distance, the brain like learns how to pick out and focus on the clear image in the distance. And then when it's looking up close, the brain learns how to pick out and attend to the clear image up close. Multifocal contact lenses are great. The way I like to explain it to my patients is that you can get through the majority of the day doing the majority of the activities that you want to do, like seeing the majority of things you need to see without ever needing reading glasses. Of course, if you're looking at like very, very, very tiny print, like on the back of like a pill bottle, you might still need to pull out a pair of reading glasses just for that extra sharp, crisp print. But multifocal contact lenses are great for just the day-to-day activities, whether it's just going outside, going to the supermarket, shopping, picking up things from the aisle. If you're going out to like a night out on town with your friends, like going to restaurants, reading the menu, you can get by with those types of activities without ever really needing to pull out a pair of reading glasses. That's what I wanted to talk about in terms of having clear vision. It's a very, very big component of an eye exam and your eye health and like just your own sense of like well-being and functioning is definitely your vision. So you definitely have options when it comes time to correcting your vision and making sure that each eye has clear vision so that your eyes can work together properly as a team. If one eye is has a very high prescription that's uncorrected and the other eye sees clearly, then your eyes aren't really working together as a team. And sometimes patients might feel imbalanced, or they might feel like they have more of a headache. The next thing that I wanted to discuss is ocular health. Some of the conditions that I wanted to discuss are dry eye, seasonal allergies, especially now that like we're transitioning into fall, and some sight-threatening diseases. So this is what I was talking about earlier. This is a photo of the back of your eye. It's the only place in the body where you can see blood vessels without cutting into tissue. So when you come to the eye doctor and we check the health of those blood vessels, we get a sense of how the blood vessels all over the body are functioning. Help, my eyes are red. So this is very common to all of us, where it's like you're just out with your friends or with your family, and somebody points out like, hey, your eyes are kind of red, and then you go to the bathroom, you like look in the mirror and you're like, okay, my eyes are kind of red, like let me figure out what I need to do. And then you walk into a pharmacy aisle and this is what you see, and you're like, it's like you don't even know which drop you need, what's going to help, what's not going to help. It can definitely be very daunting and overwhelming. So I wanted to talk a little bit about like different reasons why your eyes are red. One reason is dry eye. So dry eye is very, very common. It's like dry skin. All of us have a little bit of dry skin, a little bit of dry eye, and it's worse during different parts of the year. Like for example, like nowadays when the heat, like it's getting colder, so like the heat in the apartments and the radiators are on, like your eyes just might feel a little more dry, just like in the same way that your hands and your skin might feel a little more dry. Sometimes when your skin is dry, it can like crack and it can feel kind of itchy, right? So it can burn and sting. So sometimes if your eyes are like burning or stinging or feeling kind of itchy, that's due to dry eye, and you need like a certain type of eye drop to kind of help alleviate that or like moisturize the eye. Another reason why your eyes might be red or itchy is seasonal allergies. So in the same way that like during certain season transitions, like from spring, like during the springtime or during the fall, when there's more pollen count or the weather starts to change, people's like nose gets itchy, like your eyes can also get itchy. So it's important to come into an eye doctor to evaluate that, because there's different signs that we look at to help differentiate things between like dry eye or seasonal allergies. Now that it's like in the winter time, especially as more people start developing like cold or flu-like symptoms, It's also common for patients to get pink eye. Pink eye is like a low grade, like viral infection of the eye. It's contagious, it's like spread from surfaces to the eye or from other people to the from person to person. Like if you like touch like a surface that is contaminated and then touch your eyes. And it's called viral conjunctivitis. And viral conjunctivitis, people also have like red, itchy, watery eyes. So, you know, a red eye is very nondescript. So it's important to like come in and get evaluated for red eyes or itchy eyes. And your eye doctor can help point out which eye drop, like from the pharmacy, that you can pick to help alleviate any of those symptoms. Next, I wanted to go over a few of the leading causes of blindness in America. Vision is so important to us. So anything that we can do to help prevent blindness or detect disease early is very important. So I'm going to go over 4 conditions with everybody. The first is cataracts. The second is age-related macular degeneration. The third is glaucoma, and the last is diabetic retinopathy. So what is a cataract? From this right-hand schematic, I was talking a little bit about how like over time, the lens inside the eye changes. So in presbyopia, the lens inside the eye changes and makes it more difficult for us to see up close, so that we need reading glasses. Another change that happens in the lens inside the eye is that it becomes cloudy over time. And when it becomes cloudy, that's called a cataract. The reason why it becomes cloudy, it happens to everybody. It's just from being out in the sun, just over time, over our lifetimes, all of that sun exposure just causes some clouding of the lens inside the eye. I like to kind of describe cataracts or the clouding of the lens kind of as like a dirty windshield wiper. Like you can still see through it, but like, with over time, like the windshield wiper, it just gets more deposits, or it gets like a little white or hazy. The way that cataracts affect your vision, it can cause blurry vision, it can cause a dimming of the vision, or it just can make colors and images look a little bit more faded. Like patients can see it's not that they can't see anymore. It's just like, oh, everything just looks a little bit more dim or a little bit more cloudy. Cataracts everybody over age 40 has a little bit of a cataract, but generally it starts to really affect your vision from like, around 65 and older. That's when it really starts to affect the vision. The way that we treat cataracts is through cataract surgery, where a surgeon makes small incisions in the eye and removes the cataract and replaces it with a fresh, clear, clean lens. Cataract surgeries are very common. They're done one day in the office, and patients usually find that their vision is so much clearer and so much better after cataract surgery. One other symptom that patients might also feel with cataracts is that the glare from headlights or street lights just affect them a little bit more. That's just due to, like, if you look at the schematic, especially at the bottom, do you see how the light entering the eye, when it hits the cataract, it like scatters all over the back of the eye, versus like with a healthy lens, the light enters the eye and is focused to one point. So one of the things that I also let my patients know is that with cataracts, they just, even though they can see clearly, sometimes at night it's harder for them, especially like when driving or with areas where there's brighter lights, because there's just so much light scatter. Cataracts, like I was saying, it's treated with cataract surgery. You cannot correct cataracts with glasses. That's because, a glasses sits in front of the eye versus the cataract is inside the eye. So even if you like come in or you start noticing like, oh, wow, I wonder if my glasses prescription is changing. Like, it was stable, but now like even with my glasses, I don't see very well. it could be because there's a cataract inside the eye. Even if you are replacing or changing the lens in front of the eye, it doesn't make a huge difference. So that's the first condition. And I definitely think that like because cataracts are so common, and that like everybody over age 40 has a small cataract, it's always important to get your eyes checked, and to also wear UV eye protection just to prevent the cataracts from getting very big. The other thing is some of my patients express some concern about is, sometimes it's like the cataract is affecting their vision, but they're like, oh, it's fine. I don't want to get the cataract surgery. Like my vision isn't like it doesn't bother me that much. I think it's important still like to keep in mind, like when the cataract is mature and it's ready to come out, it's good to just take it out. Because if you take it out when it's ready to come out, then it's easy. It's a very straightforward case, straightforward surgery. If you wait too long, then the cataract can get bigger and harder and more dense, and that can create complications, and the surgery can become a little bit more complicated. So I definitely like to just let my patients know that, when it's time for it to come out, it's better to just get it out. The next condition that I wanted to talk about is age-related macular degeneration. Age-related macular degeneration is another leading cause of blindness, and this affects patients' central vision. It's very, very common among the Caucasian population. It's age-related, so it affects patients in their like 70s, 80s. The best way I like to describe it is that this area of central vision, so if you look at this diagram here on the right and you see like right here in the middle, that's called your macula. And that macula is responsible for your central vision. So that tiny, tiny little spot in the whole part of the back of the eye, like that's responsible for you seeing 20/20, all of your central vision. Everything else is just responsible for your peripheral vision. So when the macula is affected, it can be pretty visually devastating because it's like your central vision. That area, the macula, is very, very active. Like there's a lot of cells there, it's responsible for your central vision. So those cells are always functioning very highly, producing a lot of waste products. And over time, our body just slows down a little bit, and it becomes a little bit less efficient at removing those waste products. It becomes less efficient at getting rid of waste from the body. And those waste products can build up and affect your central vision. There's different ways to kind of help treat macular degeneration. So it's definitely important to go and get your eyes examined, especially if you're more at risk or if you have a family history of macular degeneration. So another eye condition that's very, very common that you might have heard of is called glaucoma. People tend to get like glaucoma and cataracts a little bit confused. Everybody gets cataracts, but not everybody gets glaucoma. In glaucoma, usually three things happen. So if you look at this top right schematic, generally in glaucoma, what happens is that the pressure inside the eye increases. And this can just, the causes are not super well known. The eye pressure increases, and it's completely unrelated to blood pressure. So some patients with high blood pressure they wonder like, oh, I have high blood pressure. Does that cause high eye pressure? And it doesn't. Like it's just two completely unrelated metrics. So in glaucoma, what happens is that the eye pressure increases, and this can either be, this is inside of the eye. So this has nothing to do with like tearing or anything. It's like the eye pressure inside the eye increases because there's just either too much fluid inside the eye being produced, or the fluid inside the eye just isn't being drained properly. Somehow there's an imbalance, and that causes the pressure in the eye to increase. When the pressure in the eye increases, that causes damage to the back of the eye called the optic nerve. So if you look at this bottom right photo, on the left-hand side, this is an optic nerve. It connects the eye to the brain. And usually, like I like to just talk about like an optic nerve. It's kind of like a donut, right? Like you have the donut, and then you have the hole, which is that little bright yellow part. So you have the donut, like the rim, and then you have the hole. In glaucoma, what happens is because of the pressure being so high, that hole kind of becomes bigger and bigger. So it's important to come and like have them check the back of your eye, because depending on how your optic nerve is shaped and the pressure of the eye, you might be a suspect for glaucoma. Glaucoma is a very, very slow disease that changes, where the changes are very gradual over time. It changes very, very slowly over time. So it's important to like go and get monitored regularly, and preferably with like the same eye doctor, so that they can monitor changes over time. Sometimes patients get lost to follow up, like, they pop into an optical here one year, they popped into an optical there the next year, and it's hard to know if there's been any changes over time or if everything's stable. So the third thing that happens in glaucoma, the first was high eye pressure, the next is damage to the back of the eye, and the third is that it affects your side vision. So this is the thing with glaucoma, because it affects your side or your peripheral vision. In early glaucoma, some patients might not even notice that they're having any vision loss, because we don't really pay that much attention to our peripheral vision in the day-to-day. Like, we just are mostly focused on our central vision. So if you look at this left-hand diagram or schematic, you can kind of see how as glaucoma progresses from early to advanced to extreme, that peripheral vision slowly gets smaller and smaller, to the point where in like advanced or extreme glaucoma, you kind of just have like a tunnel of vision or an island of vision. So yeah, I just wanted to differentiate like glaucoma from other types of eye conditions. Glaucoma is when the pressure in the eye is high, and it kind of causes damage to the back of the eye, and it can affect your side vision. And patients don't really feel, you don't feel anything from having high eye pressure. You don't feel pain or anything. So it's important to go get your eyes checked regularly, just so that an eye care professional can check the eye pressure and check the health of the back of the eye. Glaucoma it runs in the family. So if you have a family history of glaucoma, it's good to just come in, just get like a baseline testing. Glaucoma is one of those things where I like to give enough information and education to my patients so that they like know what to expect, and the importance of following up regularly. If we ever do put them, the way you treat glaucoma, by the way, is it's just an eye drop. You just put an eye drop in every day to lower the eye pressure. It's nothing very invasive or anything scary, but it is important for glaucoma because you don't really feel anything. It's important to like just be followed regularly, and the importance of compliance. But with glaucoma, it's so slow. Like even if there are visual changes, most patients, the goal is that they're going to outlive their glaucoma. Like, they're just going to outlive, like they're not even going to notice any vision loss during their lifetime. And so the last condition that I wanted to talk about today is diabetic retinopathy. So diabetes is becoming super, super common in our country, just due to increasing rates of like obesity, high blood pressure. And when people come in for an eye exam, when we take a look at the health of the back of the eye, we always ask like, oh, are you being followed for any medical conditions like high blood pressure or diabetes? So what can happen in diabetes that's very uncontrolled, or that's been going on for many, many years, is diabetic retinopathy. So retinopathy just means that the retina, which is the back of the eye, like here's the photo of the retina, retinopathy is just that the back of the eye has disease. What happens in diabetic retinopathy is that the blood sugar, when it becomes very, very high or uncontrolled, or there's large fluctuations, or like, sometimes it's very high, sometimes it's very low, or you go through long periods of time with it being very uncontrolled, what happens is that those little blood vessels at the back of the eye, they become very brittle. And they can break and bleed. So if you look at this photo, you just see like a bunch of like little bleeds all over the eye, right? Like there's little bleeds. The little yellow spots are areas of like leakage or swelling. And this is happening in the back of the eye, but it's also it's probably happening to like the blood vessels all over the body. So a lot of diabetic patients, like, they have to like go get their feet examined, and they have to go get their like fingers checked or their kidneys checked. And that's because those areas of the body, like in the back of the eye, have a lot of little blood vessels, and those little blood vessels are very susceptible to damage when the blood sugar is very out of control. When those blood vessels break and bleed, they can affect your vision. So in the left-hand photo, you see like, okay, here's a photo of a normal vision. And then in diabetic retinopathy, it really can affect your vision in a lot of different ways. Like you can just have like weird little spots in your vision. It can affect your central vision, and it can affect parts of your peripheral vision. So it's recommended that every patient with diabetes have a yearly dilated eye exam. I just wanted to go over some big takeaways. Eye doctors can be the first to detect certain systemic conditions. So like, for example, like some patients who just have been like lost to follow-up or haven't checked in with their primary care doctor in many years, sometimes we eye doctors are the first to notice changes in the eye due to diabetes or high blood pressure. Some patients also have like autoimmune diseases such as like rheumatoid arthritis or lupus, like just various autoimmune diseases that can cause changes in the eye. Like some patients can come in with like more red or more painful eyes that, it's like the eye has inflammation, and that can give insight that, oh, maybe there's another area of the body or a systemic condition, an autoimmune condition that might be causing a flare up just in the eye. Certain medications can also cause changes in the eye. So for patients with rheumatoid arthritis, if they're on Plaquenil, they're recommended to get like frequent eye exams and get monitored, because certain medications can cause changes to your vision. The next takeaway is that vision and visual function can change over our lifetimes. So, for you might be in that boat where you've never worn glasses. Your eyes have always been clear in the distance, clear up close, working together perfectly. But over time, or at this point at this stage of your life, maybe you're getting more headaches. Maybe it's like all of the remote learning, all of the working from home that's just giving you more eye strain. So meeting with an eye doctor can be helpful, because they can discuss options to meet your visual needs. If you need like a pair of glasses that's just for work, that you only wear when you're at the computer up close, and then you just leave it at your desk side, and for other activities in the day you don't really need glasses. And the last takeaway is that blindness from ocular diseases such as glaucoma, age-related macular degeneration, they can be prevented if detected early. So early diagnosis and treatment is key. Like, let's say like during midlife, where like, you aren't really being followed for any systemic conditions, vision's pretty stable, like you've already gotten, glasses for distance for reading, maybe like 2 years is fine. We still recommend every 1 year in case like something happens, but 2 years is fine. But if you have any sort of like eye conditions or systemic conditions, every year is recommended. If especially over like age, like around age 50 to 65 and older, it's like recommended every year, because you never really know how your systemic health is changing. If you have certain eye conditions, like eye diseases that I was speaking about, then your doctor might want to follow you a few times a year. So, but just in general, it's just a recommended like a yearly eye exam. When you're looking up close, like I was explaining, there's like that focusing muscle in the eye that has to work hard to like focus up close. And when we're now that like our world is changing, right? Like we're all on the computer 8-10 hours a day, and then the remaining 5 hours we're on our phones and iPads. So like, there is a lot more strain on the eye. And so wearing glasses for computer helps to alleviate that eye strain. So even though you don't necessarily need anything for the distance, and maybe they checked your up close vision and it was perfect too, sometimes having a pair of glasses for the computer or for reading is just more comfortable. Like during my time in optometry school, when I was just studying like 8 hours a day, I would wear reading glasses on the computer. Even though I can see with and without glasses, reading glasses just made it more comfortable. So that's why it's important to go and discuss with your eye doctor, because you might have clear vision, but your vision might not be comfortable. I see a lot of kids, so that's what I'm thinking about, right? Like remote learning, like all the kids are like on iPads, everything so much now that there's a lot of near work, and near work can cause myopia. So myopia, it sounds scary, it sounds weird, but it's basically just nearsightedness where you can see up close, but you can't see far away. So a lot of us are nearsighted where you can see up close, like people who've worn glasses all their lives, let's just put it that way, are nearsighted where, like you could see up close, but you couldn't see the board. And then you went to you went to the eye doctor and got glasses for far away and up close, like everything. So that's called myopia. And there's definitely ways to kind of help slow down the progression of myopia. So if you know of anybody, or you yourself have children who are more nearsighted, or you're just worried that their prescriptions have been going up, then you can go and speak with an eye doctor. And there's different treatments to kind of help slow down the progression. So it's not like it's ever going to reverse the number or stop the progression, but it can slow down the progression. And one of the treatment options is just using an eye drop every night. It should be every night. And there's certain specialty contact lenses that can also that are shown to help slow down the progression. If you're seeing halo around streetlights at night, there's kind of a couple of reasons for that. One is just maybe you have uncorrected glasses prescription, like your vision's blurry all the time, and then it's just worse at night because at night, sometimes our vision, if you don't have proper glasses correction, it's just blurry during the day, but it just feels blurrier at night, especially around brighter lights. The other thing is, if there's really bad glare, it could be related more to a cataract if you fall within that age. So LASIK eye surgery is laser eye surgery to the front of the eye. And generally, if you've done any sort of laser surgery to the front of the eye, it's just common to have some halos around lights, but there's not really anything you do for that. Usually your brain just kind of learns to ignore it, but it's because it's because you did laser to the front of the eye. So it's just changed the shape a little bit, and light might just scatter just a little bit. For patients who have seasonal allergies or dry eye, they always ask about contacts. I would definitely speak with an eye care professional about that, because contacts are great. I love contacts, especially with masks and everything. Contacts are amazing. You don't have to worry about fogging. You have clear vision. You have good peripheral vision with contacts. But at the end of the day, it's still a piece of plastic that's sitting on your eye for 12 hours. If your eyes are already irritated or dry or itchy, putting a piece of plastic on the eye for 12 hours, it might just make it a little bit less comfortable or make your vision a little bit unstable. So I would speak with an eye care professional about that, because there's definitely ways to either calm down the allergies or treat the dryness to help make you a very successful contact lens wearer. Come see us at Union Square Eye Care. There's an office up in Harlem and one in Union Square, so accessible from all 5 boroughs.